Bismillahirrahmanirrahim. Fracture. A discontinuation in a bone is called as fracture. Any break in the continuity of bone is called as fracture. There are two main types of fracture: closed fracture and open fracture. Closed fracture is also called as simple fracture. This is the type of fracture in which the bone breaks while the skin is intact. In an open fracture, the fracture is continuous with the breakdown of the skin. When the skin is not intact, that type of fracture is called as open or compound fracture. A compound fracture occurs because of two reasons. When the bone is broken and one or two of its pieces pierces out towards the skin and the skin breaks, this is called fracture, open fracture from the inner side, or a bullet injury, or with a fierce body which pierces the skin from the outside and then goes and breaks the bone. So this is the open fracture or the compound fracture from the outside. These are two types of and two mechanisms of an open or compound fracture. When we discuss fractures according to the type of injury or the type of breakdown, there are too many types of fracture. Transverse fracture. When a bone breaks at 90-degree angle to the line of bone is called as transverse fracture. Linear fracture. When a fracture occurs parallel to the line of bone, this is called as a linear fracture. Spiral fracture. When a bone breaks in more than one surface at a single point, this is called as spiral fracture. Stress fracture. Stress fracture occurs due to repeated trauma or repeated stresses. A fracture of the calcaneum and the navicular bone of a vertebral body usually occurs due to a stress fracture. Stress fracture is due to repeated trauma, and this occurs in people in army or police who march on ground repeatedly. Green stick fracture. This type of fracture occurs in children and in ribs. These are called green stick fractures because the bones in these type of fractures are more elastic. Segmental fracture. This is a type of fracture in which the bone breaks at more than one point and there is an open segment located within the bone. Bone fractures at 2 points or 3 points, and open segments are there in the bone. So these are called as segmental fracture. A comminuted fracture is a type of fracture in which the bone breaks into more than 2 or 3 pieces. So this is called as a comminuted fracture. This type of fracture usually occurs in patella and in the olecranon process. It may also occur in other parts. When there is a crush injury, usually a comminuted fracture occurs. A hairline fracture is a type of fracture in which the bone breaks, but there is a hairline appearance, a hairline gap, and a minute gap which appears upon X-rays. Causes of fracture. When we discuss causes of fracture, we find that a fracture occurs due to trauma. This occurs due to a road traffic accident, due to a gunshot injury, a fall from a height, stresses, repeated minor stresses which leads to fractures, and pathological fractures. Pathological fractures are those fractures which occurs due to some disease like cancer, osteosarcoma, osteogenesis imperfecta, osteoporosis, and osteomalacia. If a person already has these type of diseases, then the bone will break with a normal force. An abnormal bone breaks with a normal fall or a normal force. So this type of fracture is called as pathological fractures. Other type of fractures occurs in a normal bone with an exceeded force, with an extra force, not with a normal force. So these are some types of fractures. I hope this short definitions will be helpful for some physiotherapy, medical, and nursing students and other people related to the medical field. Thank you so much for hearing. Also, I request you to please subscribe to my channel. Thank you so much.